Janita, you're here? Okay.
Yes, and you should be able to see me. My camera is on. I'm just keeping my mic off if I'm not speaking.
Yep, I can see you.
Okay, good.
I think we're ready, Amy.
Okay, so I'd like to call the December 7th Hearing Aid Dispensing Advisory Board meeting to order. I'm going to go through the agenda. So the first item is a roll call. And I know that Denise has been, making sure everybody's here, but I'm going to go through it one by one. So the first one I'm going to go through the list of names and just say here if you're present. First one is Jerry Bergman.
Here.
Florence Butler.
Here.
Peter Fisher.
Here.
Anna Kim. Anthony Becerra. Ann Orsina.
Here.
And Zaida Shapiro. Okay, so Dave Mossberg, does that allow for a quorum or no?
Hi, good morning, everybody. This is Dave Mossberg. No, I don't believe it does. Just to confirm, I only heard 5 board members present. We would need at least 7 in order to constitute a quorum.
Eric Freeman.
Oh, I'm sorry, Eric Freeman, I didn't include you on that. I apologize, Eric. So that's Eric also.
Right, so I have, if I missed the board member, if you're present, just indicate. I have Zanita, Jerry, Florence, Peter, Ann, and Eric. So that's 1, 2, 3, 4, 5, 6. Are there any board members present that I did not just call? Okay. Since there are no other board members indicating that they're here, I still believe we're 1 short. We would need 7 members.
Thank you, Dave.
You're welcome.
Okay.
It looks like Jerry was trying to say something.
Okay.
He's on mute.
Is the quorum of the members who have been appointed, or are vacancies counted toward the quorum?
Vacancies do count towards the quorum. There has to be a special provision in the statute to exclude vacancies. We have that in some of the other statutes. However, this particular statute, Section 791 of the General Business Law, does not provide that we can ignore or exclude vacancies. So it's the total number seated.
The roster that you sent out for this meeting shows 5 vacancies. 5. 1, 2, 3, 4. 1, 2, 4. 4. So how will we ever have a quorum?
This is Eric Matson. I've been nominated for your old geezer spot, but we're waiting on the governor. I don't know if I can be counted.
Hi, this is Dave again. So unless you're actually seated and appointed, unfortunately, those individuals who may be pending would not actually count for a quorum. We do technically have enough appointed members so that we would meet the quorum. There are 1, 2, 3, 4, 5, 6, 7, 8. So we do technically have more than enough to constitute a quorum for those who are actually appointed. Just unfortunately, it doesn't appear we have a quorum for today's meeting.
Thank you.
So Dave, is there any way we could possibly reach out to the members that have not been attending these meetings find out they will be joining in the future so we can know ahead of time?
I believe that that is something that the board coordinator and the department, we do try to ensure that there is a quorum beforehand. The board is statutorily required at least to convene a certain number of times per year. So I believe in part that is the purpose of scheduling the meeting. But I do believe that the department does make a reasonable and best effort to try to ensure that we do have the quorum.
Okay.
That is correct, Dave. Denise reaches out to the board members and sometimes they can't show up last minute but we do have to have a certain amount of meetings. So thank you, Dave. Okay. I'm going to continue on with the agenda. So I'm going to start going over the department reports. The first item is the enforcement report. Ernita, can you please speak to that?
Yes. Good afternoon, members of the board, Department of State officials. I will be getting stats for 2020. Can you hear me?
Yes, we can hear you.
Can everyone hear me? Okay. I'll be getting stats for 2020 relating to the complaints that we received. We did have very little activity this year in 2020 from January the beginning of the year till the present. We received 4 complaints against our hearing aid dispensers. We, in the same time frame, we closed out 4 complaints against our dispensers. We add types of dispositions that the cases were closed under. We had 1 case that was closed, no violation. We had 2 cases that were closed, were withdrawn after being filed with us, and we have 1 case that was closed, insufficient evidence. Our types of complaints of these cases that were closed, one complaint type involved the inquiry of a administrative fee that was charged after cancellation of the service, and the other complaint that was filed was allegations on unlicensed activity, and there was not enough evidence to substantiate that claim. That is my report. Thank you.
Thank you, Ernita. Does anybody have any questions for Ernita?
Comment, please.
Okay.
Ernita is calling from a telephone or from some source that does not have a decent microphone, cell phone maybe. The captions totally garbled what she said, did not understand 1 word. The platform you use should make it possible for slides to be shown on a split screen. And I think that if Arnita doesn't get a better microphone or a camera, that her participation will be totally useless.
Okay. Understood, Jerry.
Can I ask Arnita a question about her report?
Yes.
Yes.
We recently heard online, some of us, a wonderful presentation by the National Federal Access Board's Enforcement Department regarding the number of complaints for the past 12 months, the categories of the complaints, the adjudication of those complaints, either closed or referred to another agency that had jurisdiction. I'm wondering why we can't get such similar data rather than the statistical handouts that came to us prior to the meeting, which really I don't understand in the slightest. I would appreciate Arnita's reaction.
Well, we provide, again, we were talking a little earlier about how many meetings we have a year, and out of the, I believe it's 4 required meetings. At each one of those meetings, we do provide a report of our enforcement activity for that current period. What are you asking that we provide that data in writing?
I don't understand the nature of the complaints that you receive by category. I don't understand how they are processed. I don't understand what the feedback is and whether there is public disclosure of any of that. It should be available to us in some way, shape, or form. And I'm just saying, I don't understand what's being done by the Department of State at the moment. Forgive me for my ignorance. I may not belong.
Well, when we provide the reports at the board meeting, we don't provide specific details of each and every complaint that's filed. However, we do have, under the Freedom of Information Law, if you want to find out about a closed file, you can make that request and you will get specific information on that particular file.
Can you tell me in a nutshell what your function is? You keep mentioning companies. I thought your job is to enforce the law regarding complaints against specific audiologists or dispensers.
It sounds pretty much on point. Yes, it is. That's what we do. We enforce the law.
Yeah, but you mentioned companies.
I'm not sure at which time I mentioned companies, but we're talking about our licensees. So if I did make reference to companies, I'm making reference to our licensees.
I guess I will stop asking questions because I can't understand what she's saying. And does anyone else have my frustration?
Jerry, this is Eric. My understanding is that Anita and her department checks into any of the complaints that consumers present to the state, and that this year there were only 4. Of those 4, they were for different reasons. And that could be towards audiologists, dispensers, and or registered companies hiring of those dispensers. So the good news I hear is that there were only 4 complaints to the state regarding our registered hearing care professionals.
And do we have any information on how those were adjudicated?
That information I don't believe we get in detail, but as Anita said, it can be requested via the Freedom of Information Act.
Why should it not be given to us as to whether a complaint was denied, whether there was some negotiation to reach a settlement, or whether a license was revoked in the worst case, I would think?
And well, Jerry, I don't have all the information on it, but I would probably say it's because we're an advisory board, not an enforcement board.
Yeah, but
well, I mean,
but we can't advise unless we know what's happening. That's my point.
Okay, we closed 4 cases this year. That's what I reported. We closed 4 cases. And of the 4 cases, I indicated the disposition for each one of them. I'll repeat it. 1 was closed, no violation. 2 complaints were withdrawn without any administrative action, and 1 case was closed based on insufficient evidence. So those were the dispositions of the 4 cases that were closed this year. We still have currently, and I'm adding this now, open cases. We have 12 cases that are open, but we can't discuss those cases because they are open files.
Well, open and closed is fine, but you can't give us any more information.
I can provide the file numbers to you, and we could do that. I'll give it to Denise, and if she wants to distribute it, and I will get approval from Amy. But I'll give you the file numbers of the cases
Jerry,
that closed,
no,
and we would be able to do a FOIA. Sorry, who's that? Amy?
yeah, it's me. Jerry, we can provide for the next meeting the number of cases that have been closed. We can tell you the number that are currently open, and we can tell you the reason that, or the method that it's been closed by. We can't get into specifics about cases as far as using names and whatnot over the board meeting, but we can provide you something in the board in the jacket next time that gives you the total number of stats to review as Ernita goes over it for the next board meeting.
I appreciate Amy, but I'm looking for a qualitative assessment so that we understand the nature of the complaints being filed. What are the problems that have resulted? What kinds of people are filing complaints? Who are they filing them against?
We can't give the details of open. We can't give details of open cases at this point and the names of the people over the board meetings, but we can give you stats, and we can provide you the type of complaint that they're filing against. Like if you want to know whether it's due to refunds, we can give you that type of material. We can give you the type of complaints that we are receiving.
I'm sorry to monopolize time. Just my last comment is we cannot understand what the state's job is in enforcement of complaints unless we have an idea of the kinds of complaints that you're receiving. Forget confidentiality. I don't want to know anybody's name. I don't want to know any case numbers, but I would like to know where there's possible violations and those have been brought to your attention and how they've been adjudicated. Again, no specifics, but I think that I'm asking for an evaluation of the system and how it's working and the degree to which it's resolving issues that exist. That's all.
Hey, Jerry,
Okay.
if this helps, the HLAA, you had commented previously that there have been a lot of providers that do not discuss at time of dispense or at time of a purchase T-coil benefits. The thing is, the state cannot move forward on that unless a consumer complains about that to the state. Okay. So as a member of HLAA, you know, and I know that unless it goes from the consumer to the state, there's nothing for the state to go on and enforce. But if you're hearing information like that, inform us, because there are members on this board that can inform the New York State Hearing Healthcare Alliance of New York, and we can have that information shared over. Say, hey guys, we got to do a better job. But that's not going to come from the state unless the consumer complains.
Oh yeah, of course, I agree.
So anything to make Fred Goosen's life a little harder, I'll do.
Okay.
Okay.
All right. Moving on to the next agenda item, the processing report. Emily Lupi.
Hello, this is Emily Lupi with the processing unit. Included in the materials you were provided, you will find licensing statistics for November 2019 and November 2020. The report shows the number of hearing aid businesses broken down by county and a business list broken down by class code or license type. The 2020 numbers include only licensees and do not include those licensees whose licenses may have expired and are covered by Executive Order 202.11, which allows individuals licensed by the Department of State to extend the expiration of their license during the state of emergency. Thank you.
Thank you, Emily. Any questions? Okay. Our next agenda item is the education report. Allison Lacey.
Good afternoon, everyone. This is Allison Lacey, and I'm giving the education report today. The Bureau of Educational Standards continues to audit hearing aid dispenser renewals. Those renewals which do not indicate approval code numbers or do not appear to include T-coil, infection control, and New York state and federal law, in addition to the balance of required hours, are not processed. They are sent to the Bureau for an educational compliance audit. A renewal license will only be granted when satisfactory proof of education is provided. To date, 57 licensees have been audited and 52 have complied. Of the 5 non-compliant, 3 are still within the time frame to respond. Course availability appears to be adequate and has not been an issue raised by our licensees. Does anyone have any questions?
Thank you, Allison.
You're welcome.
This is Eric. I do have a question on that. I've been asked by some of my colleagues if, because of COVID and how things are going, and this may be something to address with Mr. Goosen down the road, but mainly, will the state be able to provide CEU coverage through online programs through either the Hearing Healthcare Alliance in New York or manufacturer-based classes, so that our registered dispensers can get their appropriate CEUs?
So, to answer that question, we have our approved hearing aid dispenser schools. They are allowed to teach the continuing education courses using live distance education, as long as those courses can go back to the traditional classroom setting once the temporary approval period for live distance education has been lifted.
So just to confirm then, for any of the programs that are doing classes, if they are doing something online, that is being accepted?
They would need to email us for approval first, and then yes, that would be accepted for live distance education. The courses must be conducted live.
Okay. Next agenda item is the exam report. Shannon McGuire.
Hi, this is Shannon. Yep, this is Shannon McGuire. I'm going to be giving the examination report. In 2020, the Department of State administered the hearing aid dispenser written exam to 33 applicants with a pass rate of 52%. We are continuing to require candidates schedule their exams in advance. Instructions on requesting a written exam date are posted on our website under the examination information and schedule page. The hearing aid dispenser practical exam was administered to 53 applicants in 2020. 33 of them were audiologists and 20 were trainees. The practical exam had a pass rate of 100%. Any questions?
That's good.
Thank you, Shannon. The next item is new business. Dave Mossberg, EO complaints. EO update, executive order update, sorry.
Hi, good morning, everyone again, or afternoon rather. Emily mentioned this briefly during her summary. I'm sure as many know, because of the continuing COVID emergency, the governor has extended an executive order allowing those licensed by the Department of State to have their license remain effective and valid through January 1st, 2021. The order in part was to allow those that are licensed additional time as necessary to complete continuing education, as well as deal with, obviously, the pandemic. So that executive order has been extended yet again, and it's good through the rest of this year. If there are any updates, obviously the department will provide that information on our website, and I'm sure we will be able to provide that to the board members. Thank you.
Thank you, Dave.
Question?
Sure. Sure.
Thank you. David, Eric mentioned telecoils, and I think if I heard correctly, Allison mentioned, can you hear me? Yeah, Allison mentioned in her report that the oversight process excludes anything having to do with the statutory requirements for telecoil information. Is that correct?
No,
No.
I didn't understand that to be the purpose of her report. What I believe she was mentioning is that if somebody did submit a renewal, but their renewal didn't have an indication of the telecoil or infectious course, then they would be subject to the audit. So that they would have to provide that proof. So it's the opposite of what you were actually thinking.
Oh, so there is some oversight by the Department of Audiologists with regard to compliance with the TCO requirements?
If an individual is licensed by the Department of State and submits a renewal, if their renewal certificates does not indicate compliance with the regulations, which also covers the audiologists, as mentioned in the earlier report, they would then be subject to an audit.
So there is a request contained in the renewal application that be certified?
Yes.
Yeah.
They are required to affirm the accuracy of the truth of the statements in the renewal.
And they list their courses.
Thank you. Let the record show, Amy, please, that the department gave 4 reports, none of which had video, so we were unable to lip read or have a clear understanding of who was speaking. And, you know, the audio quality varied from pretty good in 3 cases to very poor in 1.
Yes, thank you, Jerry. We will work on the video part for the next meeting.
Thank
This is Eric Matson. If I can just interject on the question of T-coils, a lot of the major makers of hearing aids are telling audiologists that T-coils really aren't necessary given their advances in technology. Of course, that's baloney. But I know myself, I just got a brand new pair of Phonex, and when I asked for T-coils, I was told, well, you might not need them given the advances in technology. It's nonsense. We need to tell the manufacturers to back off.
Eric, this is Jerry. As Eric Freeman knows, we've been all through this at many of our past meetings, and I think everybody is aware of the problem, and Dave and I have exchanged information about what needs to be done if we're going to get more help and support of telecoils, and it's really a statutory requirement or a change in the law or regulations that would be needed.
Thank
We
you.
may work on.
Thanks. Okay, I'm going to move on to the 2021 advisory board meeting dates from Denise.
Okay.
Hi, this is Denise. I just wanted to let you know that I'll be reaching out to the board members so that we can schedule the 2021 meeting dates. If you know of any dates that you will not be available next year, please send me an email so I avoid those dates. And if you have preferences, like a certain day of the week or a time, morning versus afternoon, please let me know that as well so that I can get those dates in place as soon as possible.
Days are the best
Mondays are the best,
for me.
morning or afternoon?
I don't care.
All right, duly noted.
If I can ask a couple questions, I'm not sure if my email made it up to Denise or not. It's been over a year plus since I've been on the board, and I've raised a few questions. I'd like to see or find out how we get more resolve as an advisory board for the Department of State in order to help the consumers of hearing aids, as well as providing better information for the registered audiologists and hearing aid dispensers as well regarding what we're dealing with. And we're going through some special times, as we know. Is there anything coming down the, have we heard any more on OTC and what's happening for New York State?
I can speak to that.
I know
I don't know who's speaking back.
Hold on. Wow, that was fun. I mean, I'm familiar with OTC is what's coming from IHS, but is there more happening there? So no, it'd be nice to hear that.
I can report on that. Sorry, I don't know why. The federal government missed another deadline.
Microphone going somewhere?
Yeah, this is Eric Matz, and I actually sit on the OTC committee, and there have been no meetings because the FDA has not still released a ruling, and we can't do much until they do. A couple of Congress people have written the FDA and jacked them up and said, hey, you're past your deadline, other problems notwithstanding.
So being in the state of New York, there have been several manufacturers that are selling OTC products, and they're calling them hearing aids in the selling process or in their advertising process. I've had a few clients come in and they're showing me these devices, and they're not helping them at all. They're going past their return period, so they're stuck with these things that don't work. All because they're being told they are hearing aids. What can we do as a state or advisory board to the state to get this clarification for our consumers to get proper help? That would be one part. The other is going through COVID as we are, we're doing, as this meeting is, we are doing virtual meetings. Okay? I think we need to find a way to make sure that our regulations are not loosened, but there are processes in place in which we still can assist our clientele, our patients or clients, patients for the audiologist, clients for me, utilizing technology via web-based for video conferencing, adjustments with them and so forth, and possibly helping them get the need of hearing help that they can't get, they can't come into the office. Verbiage is important because it may not be a hearing test, but it could be what would we call that? Not even an evaluation, but maybe an assessment. But if there's anything that's coming down the road, we might need to make some changes in the regulation in order to do that properly and keeping our professional level at its highest.
Yeah, this is Eric Matson again. One of the biggest concerns I have is that they're trying to sell these devices without any testing. And we
Correct.
all know it's not appropriate for people past a mild loss. In fact, they can be damaging. I personally spend about an hour and a half a day bad mouthing a lot of these ads that I see on the social media.
Yeah.
This is Jerry. Eric
I
Freeman,
have a question.
you asked about telemedicine, I think, in part, early in your remarks. My question is, I looked into this somewhat, and my audiologist did not have the capability of doing anything for me via telemedicine. Um, Can you update me a little on that or tell me what manufacturers have provided the software you need, if there's uniformity or what's going on in brief?
So for the most part, most of the manufacturers have technology that can be utilized from a provider to assist the consumer using telehealth. However, in my experience already, the bigger issue is usability by the consumer. They may not be aware how to connect to their computer for video chat or so forth. And if adjustments are being made, they need to know how to use their phone correlation to do this. So my hopes is that we're able to get a process that there can be a little bit of flexibility, because if we're not allowed to utilize online processing in the form where it's more valid because of regulations, we're going to be limited as providers to assist our clientele using this technology, because we are not allowed to per se sell a hearing aid online. So I think it's going to be important that we can find a way to assist better without being concerned about the state coming on and say, hey, you're selling a hearing aid. Well, if we're not selling a hearing aid, but we're helping people hear better through changing the verbiage, that's fine. That's good. But it's a tough road that we're coming into. People can't come to our office; they're afraid to come out, and they don't know that we can help them.
This is Florence, and somewhat related to what you're talking about. I want to know, I see ads on the TV that Medicare is now offering hearing aids.
No.
How are people going to be able to get these hearing aids through Medicare?
And is that you?
This is Eric Johnson again. Those ads that you see on TV are not from Medicare. They're from private insurers trying to sell supplementary insurance, and you have to pay for the kind of policy that does cover hearing aids.
Yep.
So it's only one step. They're just saying if you use a private advantage type insurance, you can get a hearing aid.
That's not Medicare. It's a Medicare supplement.
Right. I think you're right.
Okay. Now, if I understand it right, whoever's on that board for IHS and so forth, I've heard a little bit where they're talking about Medicare doing more, but it hasn't gotten there yet.
Okay, it's just a supplement thing.
Yes.
I have United Healthcare, and they have a hearing aid. But when I've asked my audiologist about it, they say, we're not connected. So I was not able to get a hearing aid through my supplement insurance. Is this a universal problem?
Yes, it is. And that actually leads me to my next question. What can we do as an advisory board so that the state of New York's Department of State can get the right information so that as hearing care professionals, we can participate through insurance programs by where the insurance companies can provide a certain amount out of network. The problem is when everybody's out of network and doesn't want to work with United Healthcare, for example, the consumer, yourself, for example, Florence, is not able to get the help they need. But it's not on the provider at that point. the consumer has the right, the choice to go wherever they want. But if they're comfortable with the provider, the audiologist, the hearing care professional that they have been dealing with for years, they will not get the discount or will not get those hearing aids if they're traditional hearing aids. It could be, what's the name of that company that did United Healthcare? High Health Innovations. That hasn't been good. So we have to, as a board, to help our consumers, help our patients, clients get the right care where they can choose the product and who they go to, not be told by a company otherwise. That would be nice.
Yeah, Jerry.
Any advice to the board?
Jerry, this is Eric Matson again. United Healthcare does offer partial coverage of the cost of hearing aids, but you have to get them through their choice of provider and their choice of maker.
What's the question, Eric?
Which one? That's me.
I kind of gave up at that point.
Florence, come up to Binghamton. I'll take care of you.
It's Eric.
Okay, guys, this is Pete Fisher.
Go for it, Pete.
Okay. Number one,
But I think
the
we
insurance
need to make it
companies,
clearer.
the insurance companies are only using the offer of hearing aids as a carrot on a stick. They really and truly do not want to provide hearing aids, and they will do everything that they can to make you jump through so many hoops that you're not going to get what you think you were told you were going to get. Because unlike the rest of us who have been brought up to work hard so that we can get further on in our life, the insurance companies, when they do less, they actually make more money. So they're not really going to assist us in with this problem.
If there's anything the state can do is maybe open up the Medicaid benefit adults over the age of 19 so that you can get help, and also open up by doing so, making that cost effective for someone to participate in that program.
Yeah, this is Eric Matson again. It's my understanding that in the state of Maine, they are leveraging their life insurance license or their health insurance licensing powers to entice the providers to cover hearing aids, and that coverage right now is quite substantial, and it's not tied to any one maker or provider.
Right. In Texas, a few years ago, I'm not sure if it's still continuing, it was $5,000 towards hearing aids. And that was through Medicaid, through state Medicaid. New York can do better. When I spoke with Donna Lepardo, the concern she had is how can low income or lower income residents get help when they're on Medicaid? Well, they can't. There's no coverage for them except maybe one aid, and that may not be the needs that that person has. So again, that goes to my question earlier. What can we do as an advisory board to the state to help this move forward?
I'm sorry, I think this is Jeanette speaking. I'm pretty sure Medicaid covers hearing aids. If you're referring to Medicare, then not. But
No, one hearing
Medicaid
aid.
actually has really good coverage for, at this point, almost high-end technology.
Oh, so they brought up the technology level?
They have for years and years. I mean, they've covered pretty decent hearing aids for a very long time, at least 8 years that I've had my practice. And then at this point, last I heard, they have, if you take Signia, for example, I think X5 is already on it, which is mid-level technology. And then
they raised the
Phonak just sent
reimbursement rate?
something out with children coverage. Also, the everything went up. So Medicaid is actually covering quite a bit, even though they're only paying like $175 for the device. But the manufacturers are allowing that to be covered. So Medicaid is not the concern for those that have it. It's the
More the
ones who
price
don't have
reimbursement.
the Medicaid that might have an issue with certain devices.
So it's more along
I
the
think-
lines of the reimbursement from New York State to where providers can say, yes, we're going to participate or not.
Yeah, I guess so, because the dispensing fee has been $135
No.
forever.
Right.
And that's it. It's 135. I mean, that has not
I mean,
changed.
as
But I
a
don't know.
non-audiologist, I don't bill for testing. I don't bill for cleaning checks. I don't bill for
I know, but
programming.
honestly, the testing will pay you all of $60. It's still $135 for the dispensing, which
Right.
requires a lot of time. So then,
It does.
yes, it's up to you whether you want to accept Medicaid payments or not.
New York can do better. What can we do to help that?
I don't know. You're going way. This. Let's go. Can we get back to the agenda? I mean,
Yeah, good point.
Okay, this is
Thank
Peter
you.
Fisher. I'd like
Can
to
I
say
ask-
one more thing
can I
about
ask Fred-
Medicaid.
Fred Goosen to comment? Fred's still
No,
on the line, I
I-
believe.
This is Peter Fisher. I have a comment. Okay. I accepted Medicaid for many, many, many years until about 5 or 6 years ago. At that time, we got paid a dispensing fee of $135 and were required to service the instrument for a total of 5 years with no additional remuneration. That turned out to be $27 a year. I don't want anybody walking through my door 6 times a year for $27, and so I quit using or accepting New York State Medicaid. That's it.
Is anything being done at the state level?
from what I understand, the state is cutting quite a few things, especially with COVID. Services in schools are being cut. So I'm pretty sure that the hearing aid is not on the top of their list right now to increase reimbursement. So, that's just from what I know about what New York State is doing with their budget.
Well, we have a state association like the dispensers do. And if there are issues of common interest that we should bring to the attention of our legislators in Albany, I wish somebody would send them to me as chair of the Advocacy and Legislative Committee of the State Association.
Hello, can you guys hear me?
Yes, hi, Amy. We can hear you.
Hi, thank you.
Hi, Amy.
Okay, that was a great discussion. I'd like to move forward with, if there's any agenda items for the future that you would like to talk about, please send them to Denise for the next board meeting. And I would like to move forward with closing this meeting.
Very good. So move.
Okay. All right, so we'll close this meeting. Thank you, everybody, for your attendance. Have a good day.
Thank you, Amy.
Thank you
Bye,
very much.
everybody.
Thank you.
Bye.
Bye.